Hi everyone, I'm Kinezag Trap. So today I'll be talking about fear of accidents. So introduction. Have you ever felt the smell of fear where you can literally hear your heart start to sweat and feel the adrenaline rush? So fear plays a role where it can limit the function of a person's life. So humans confronted of a perceived danger will respond in different ways. So the topic purpose is to be able to conquer fear like fear of accidents in order to overcome and minimize harm or injury. So the thesis statement is the efficiency of successful therapy for a dystrophic individual vary depending on the fear of response and willingness to regulate inherent possible risk in a routine or daily life. So first, what is dystrophy? Dystrophy is a scientific term for a fear of accidents. So the actual worry of a person feels about causing any form of injury. So all form of injury can happen anywhere in our daily life. So it can be a home, it can be at workplace, public space, and road base. So mild case versus severe case of dystrophy. So people with fear of accidents might feel like life is inherently risky. Like, for example, mild and severe cases could limit significantly of a person's life. So in driving, so the mild case is the person drives before rush hour to avoid collisions. So for the severe case, the person cannot drive because the thought of death in a collision occurs. So for construction work, the mild case is the person cannot stay long but is willing to work in an area where there are heavy equipment or machineries that might cause injuries. So for the severe case is the person cannot really do work in an area which might cause injury. So some people experiencing this digiphobia can still balance risk and curb fear out of accidents. For others, sudden changes can affect their routine and gradually avoid more activities which impair them more. So psychology psychology of fear of accidents. How do we as humans perceive fear of accidents? First is for emotion. Emotion gives us the universal response in order to sense of fear. There are two stages of fear response. First is biochemical, where we can feel the increase of heart rate, sweating, constriction of blood, vessels and nerves, adrenaline rush, start to get stressed, and for the second is for emotional, which is highly individualized, as stimulus is perceived, and the body responses either positive or negative. So example is riding a roller coaster. First, for the biochemical, you can feel sweat, increase of heart rate, and trembling. So for the second is emotional, which is for positive, happy. You will feel like try the ride again and again. For the negative is crying, shouting, cursing not to ride the roller coaster again, collapsing. So for acclimation, a person exposed to similar situation may lead to familiarity. So acclimation stimulates the persons to reduce fear of accidents, resulting to automatically. So it minimizes the fear and helps to feel more comfortable in a different environment. So third is the treatment. So here, you will know the source of fear, get help with a therapist, so the therapist will develop an individualized treatment plan. So there are two techniques. First is systematic desensitization. So here, the client is gradually led through a series of exposure situations. So for the second is flooding. The client is exposed to vast quantity of the feared accident or situation until the fear diminishes. So example of treatment plan is fear of riding an airplane due to any form of flight explosion. So first is present the problem regarding flight issues. Second, enlist goals to the patient in order to treat the fear, including length of sessions required. So third is use methods like showing pictures of airplanes, exposing to model airplanes, and others. Fourth is assesses and apply other new coping techniques to manage the fear response. Fifth and lastly, patients should overcome or at least feel more comfortable riding the plane after the session. So, the person with this phobia or fear of accident should always be involved in developing the treatment plan. The gathered results are the therapeutic responses of the patients. Most therapies provide a copy of the treatment plan in order to for the patient to know the process which will take place while conquering or overcoming the fear. So there. So the conclusion of this is proper treatment will aid you not to live with uncomfortable and life-altering fears. Next is when fear is managed, a balance will fit the person's personal comfort zone. And lastly, treatment will lead to accept the inherent risks of life, particularly related to phobia or fear of accidents. So, a person needs to be willing to accept and conquer fear. It is the best for persons to recognize its fear, to be able to overcome and minimize high risk and actual injury. So overall, overcoming fear of accident by therapy will provide better series of therapeutic goal management to be able to help others and who are experiencing this kind of ordeal. So there, thank you.